Hello everyone. I will take next few minutes to talk something about the recent advances in the management of ITP. As we know, the first-line treatment is corticosteroids and IVIG and anti-D. And the second-line treatment, the first choice is TPO receptor agonist, and the second is rituximab, the third is splenectomy. And if your patient fail to respond to this treatment or get a very fast relapse, you have to find other ways of treatment. In recent 5 years, there are 4 to 5 new or old drugs which has the potential to be used as a second-line treatment in ITP. And today I will tell you few of them. The first one is Rosanolyxismab, which is a monoclonal antibody against Fc receptor N on the surface of macrophages. And according to the early phase 1 study, this antibody can reduce the IgG antibodies in the serum of the patient, and also as a dose-dependent manner. So these drugs can be used in the future to treat refractory ITP. And the limitation of this drug is that safety profiles. One have to explore more on the safety profiles of this drug. In the early studies, the safety profiles shows the adverse events including headache and also liver function deficiency and some others. So let's see. We will wait. Now this drug is on the phase 2 study, so we will have to take some time to wait on the result of this study. And the second drug, which is potential to be used in the refractory ITP, is called Martinib. And this Martinib is a Syk inhibitor. As we know that Syk signaling pathway is very important in the platelet production. And if you inhibit the Syk, the megakaryocyte might be maturate better and produce more platelet. So in studying phase 1 and phase 2 studies, the response rate of Martinib is close to 40%. As we know that refractory ITP is very difficult to treat, and one can get 40% of response is not so easy. So this drug is also very positive, has the potential to be used in refractory ITP in the future. And the third drug is called the Avatostatic. Actually, it has been launched in the United States quite recently, which is very similar to the other TPO receptor agonist. The response rate is close to 70 to 90%, and the limitation of that is also thrombosis, and the cost probably very expensive. And the third is that one have to pay attention to myelofibrosis. And the fourth drug, which is not a new drug, it's a very old drug, it's called Avatostatic. And these statin drugs we commonly use to treat high glycemia. However, this drug has an effect on the endothelial cell boost. One can use statin in the laboratory to boost the endothelial cell in the microenvironment of bone marrow, which might be helpful for megakaryocyte production of platelet. And quite recently, there's a paper published in Blood from the People's Hospital of Peking University, and showing that Avatostatic might be useful in the treatment of corticosteroid-resistant patient, which can overcome resistance to corticosteroids. So this might be a very good news, because this Avatostatic is quite cheap and very commonly used, and the safety profile is pretty good. So let's hope that we can have more clinical study on this, get more evidence to support their future use in refractory ITP patients. And the fifth drug is also an old drug called decitabine. And decitabine is widely used in the treatment of MDS and AML. And the mechanism of action is demyelification. And decitabine is, when we treat MDS, the most quickly response theory is platelet. If one have a response on platelet count, then which indicate that the response to decitabine might be good. So because of this, we have studied decitabine in our laboratory, in our mouse model, and to show decitabine, especially very low dose decitabine, can boost megakaryocyte platelet production to increase the platelet production. And recently, we have published our work, multi-center single-arm study of low-dose decitabine in the treatment of refractory ITP in American Journal of Hematology. And our study shows this low-dose decitabine has a response rate of 50% and long-term response rate of 30%. In other words, the response rate, the treatment effect of decitabine is close to rituximab. So we have also started a 2 phase 3 study on newly diagnosed ITP patient and also a study on refractory ITP to get more strong evidence to support the future use of low-dose decitabine in refractory ITP. So in conclusion, there are many new and old drugs which can be used in future to treat refractory ITP. And one is Rosanolyxismab, Martinib, and Avatostatic, and Avatostatic, and decitabine, and many others. So let's hope that the future of ITP patient is very bright. Thank you.